Okay, today I want to take a look at the overall, the kind of the layers of the heart, and then some problems that take place, and then some things we do to fix those problems. So if I take a look at the layers of the heart, starting from superficial and going deeper, the very outside layer is the epicardium, and then the muscle part is the myocardium, and the very inside part where the blood would touch on the inside is the endocardium. The epicardium, we've taken a look at the serous membranes before. They're around pretty much everything in my gastrointestinal tract, in my abdominal cavity. The one that's attached to it is called the visceral, and it's around the very outside of the heart. It looks like it's clear and it's like cellophane, and you can peel it off, but it is attached to the heart. Then there's a little gap in there that has serous fluid, very, very slick, and then around that you have another sac called the parietal that makes up the serous. But that epicardium is the one that is attached to it. Again, that's the visceral, and it's that really thin layer. Then as I go deeper, the myocardium, again, that's almost the entire heart. And it's really thick and it's really strong. It's the only place in the body that we have cardiac muscle. In this picture, it looks like there's huge gaps in here for the blood to pool in. It's a little misleading that they're really small in there. Almost all of the heart is made up of muscle. Then again, on the very inside, you have epithelial tissue. That would be on the very inside. So epicardium, very thin layer. Endocardium, very thin layer. And almost all the rest of it is the myocardium, which makes sense because we need a very strong muscle to pump the blood. If I take a look at the cardiac cycle real quick, the systole and diastole, that's the high blood pressure, the high mark. When the heart pushes the blood out, that's going to be the high. So in a blood pressure, when they put a blood cuff on you and check your blood pressure, that high number, that's the systole. Then the diastole, that's when the heart basically relaxes. And let's say we take a look at a normal male, the normal blood pressure is usually they consider to be about 120/80 millimeters of mercury. And that's the high blood pressure and the low blood pressure, high and low. The pulse on someone your age is probably somewhere, at a resting pulse is probably between 60 and 75. Usually the better shape you're in, the lower your resting blood pressure is. Pulmonary circulation, we have a huge amount of the blood when it goes to the lungs and then back to the heart. That's the pulmonary circulation. That's where we oxygenate the blood. Systemic is then when we kick it out through the whole body and nourish all the cells of the body. I want to take a look at the coronary arteries. When I take a look at the arteries, if you probably know somebody who has had bypass surgery, or you've at least heard of that. What happens in a bypass surgery? Well, one of these arteries in the heart, as I come down here, anywhere in there, they get clogged up. And we need to go in there, and if it's bad enough, you've heard of it, says you heard Grandpa has 80% blockage in one of his arteries. Well, that means that only 20% of the blood can get through. So that's obviously a problem. So there's some different things that we can do. And if I go down to that, one of the things we used to do a lot of is balloon angioplasty. And basically they would start, and they'd usually start in your leg and feed it up and end up going through the aorta, and then they take that and they take it into the bad spot. So in this case, let's say that it's blocked right there. They take this instrument, and so there's the blockage right here, magnified. They put that up into that, and this balloon part of it, it's not actually a balloon, but it blows up kind of similar to a balloon. When they get to that blockage, they blow it up. So inflate the balloon. What does that do? It spreads that open, breaks chunks loose, and fairly quick, and I shouldn't say painless, but pretty pain-free for the patient, and quick recovery. Unfortunately, they found that these a lot of times would just go back pretty quick. So instead, what they do now is they put a stent in. You've probably heard of that. So they do the exact same thing as they did here with the balloon angioplasty. But when they get to the bad part, instead of a balloon, that this wire mesh basically, and it's not inflates, but it spreads open, and it's medicated so that the deposits do not keep depositing on there, and that stent then just stays in and it spreads it open. Those are, I think they're good usually for a couple years at least, and a lot of times they have to go in and put another one in. But they found out that those are a lot more efficient than the balloon angioplasty. Another thing I want to talk about is the thing that you've heard also is a bypass surgery. So in that same method that we took a look at down there, let's say that we've got blockage right here. Well, let's say that it's too bad for a stent or balloon angioplasty. They can go in and they can cut it right here above the block and cut it below the block, and then they bypass that. Like they usually take a part of a vein out of your leg, usually the great saphenous part of that, and they put it in there. So it bypasses that spot. Now, what's a double bypass? They had to do it in 2 spots. What's a triple bypass? They had to do it in 3 spots. The last thing I want to take a look at is some things that happen to the arteries through time. The arteriosclerosis, that's a hardening of the arteries that usually accompanies, I guess, old age. The compliance, the vessel usually expands and contracts with every beat of the heart. The flexibility of that gets worse and worse the older you get. So it doesn't flex as much. And what does that do? It increases blood pressure usually for somebody that's older. Atherosclerosis is actually the buildup of plaque inside of there, which is usually attributed to high cholesterol, fatty diets for long periods of time. But both of those will restricted blood flow and build up blood pressure. Okay? And that's the topic for today, is the layers of the heart and some problems and some things we do to rectify those problems. Thanks. Bye.